Prostate cancer is a serious threat that affects millions of men worldwide. In fact, it's the second most common cancer in men globally. And that makes it very important to know about its signs and symptoms, so that you can get yourself treated before it's too late. So in today's episode, let's explore some of the most common signs of prostate cancer you should never ignore. Without any further delay, let's begin. Number 1. Frequent urination. Frequent urination can happen due to many reasons, such as drinking excessive fluids, alcohol or coffee, certain medications, urinary tract infections, or an overactive bladder. However, frequent urination can sometimes be a symptom of prostate cancer. The prostate is a small gland found only in men, and it plays a key role in producing seminal fluid. However, when prostate cancer develops and the tumor enlarges, it may start to press against the bladder. This pressure on the bladder can make you feel the need to urinate more often than usual, even if you don't have diabetes and haven't consumed a lot of fluids. So if you notice frequent urination or have any concerns about your prostate health, it's crucial to consult a doctor. They can perform a few tests, including a prostate-specific antigen blood test, digital rectal examination, and possibly other diagnostic tests to assess the health of your prostate. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. Difficulty urination. When the tumor grows in the prostate, it can partially block the urethra, the tube that carries urine from the bladder out of the body. This can cause difficulties whenever you start urinating or completely stop the flow. Plus, it can also cause post-dribbling, which means that a small amount of urine can still remain in the urethra and trickle out suddenly after urination. Again, this doesn't necessarily mean that difficulty urination is always due to prostate cancer. It can also happen due to non-cancerous growth in your prostate, as in benign prostatic hyperplasia, or BPH. But if you do have this sign, do not ignore it, and be sure to get yourself checked as soon as possible. Number 3. Weak or interrupted urine flow. Another one of the most common signs of prostate cancer is weak urine flow. It can happen when the tumor is blocking the urinary duct, due to which the stream of urine is not as strong or forceful as it should be. But this symptom is less common than other signs and symptoms of prostate cancer. In a study published in the International Journal of Urology, it was reported that approximately 75 to 90% of men with lower urinary tract symptoms, which can include weak or interrupted urine flow, have benign prostatic hyperplasia. But nevertheless, you should never ignore this sign, because if it gets worse, it can lead to more severe outcomes, including urinary tract infections. Number 4. Pain or burning sensation during urination. Honestly, prostate cancer itself doesn't always cause pain or a burning sensation during urination. However, there are situations where prostate cancer can indirectly lead to these symptoms. Let's see how. When prostate cancer advances and spreads beyond the prostate gland, it can affect nearby structures such as the bladder, urinary duct, or surrounding tissues. In such cases, prostate cancer can obstruct the normal flow of urine, leading to urine retention in the bladder or incomplete bladder emptying. When urine stays in the bladder for a long time, it can increase the risk of developing UTIs. UTIs can cause many symptoms, such as painful urination and a burning sensation. Moreover, prostate cancer can also cause irritation or inflammation in the bladder or prostate gland, leading to pain or a burning sensation whenever you try to empty your bladder. So you should never ignore this sign, and get yourself checked as soon as possible. Number 5. Blood in urine or seminal fluid. In some cases, prostate cancer can cause bleeding within the prostate gland or urinary tract. This can lead to blood mixing with the urine, resulting in a condition called hematuria. This presence of blood can give the urine a pink, red, or brownish color. Hematuria can also happen in other conditions, such as urinary tract infections, kidney stones, or other bladder problems. Additionally, prostate cancer can also cause a condition known as hematospermia. In this condition, the cancerous growth within the prostate gland or the nearby blood vessels can cause small amounts of blood to mix with the seminal fluid during sexual activity. Although the metaspermia is often benign and may not necessarily be due to prostate cancer. But if you notice this sign, take it as a red flag for your prostate health and get yourself diagnosed by your health specialist. Number 6. Erectile dysfunction. Erectile dysfunction can happen due to many reasons, one of them being prostate cancer. It can happen when prostate cancer becomes large enough to affect the function of muscles or nerves involved in erection. But surprisingly, erectile dysfunction can also happen as a side effect of certain treatments for prostate cancer. For example, hormone therapy is often used to reduce levels of male hormones to inhibit the growth and spread of prostate cancer. This way, it can cause reduced libido and reduced erectile function due to the lowered hormone levels. Other ways of prostate cancer treatment include radiation therapy and prostatectomy, the surgical process to remove the prostate gland. Radiation therapy is done to destroy cancer cells in the prostate gland, which can also damage the nearby healthy cells around the prostate, leading to the symptoms of erectile dysfunction. Similarly, although surgical techniques for prostate cancer removal have become quite advanced, however, there is still a risk of temporary or long-term erectile dysfunction after surgery. Number 7. Pain or discomfort in the pelvic area, lower back, or hips. As the cancer grows or spreads, it can affect nearby tissues and bones. This can lead to feelings of pain or discomfort in the pelvic region, lower back, hips, spine, and sometimes even ribs. This pain feels like a dull ache, often comes and goes, and becomes severe as the cancer grows. In some cases, prostate cancer that has spread to the spine can also compress the nerves. This can result in pain that travels from the lower back or pelvic area down the legs, causing sensations of numbness, tingling, or weakness. Number 8. Unexplained weight loss. If you have noticed that you are losing weight despite having a healthy diet and lifestyle, then it may be a sign of prostate cancer that you shouldn't ignore. Actually, prostate cancer that has advanced can disrupt your body's normal metabolism and energy balance. This is mainly because the cancer cells can consume a significant amount of energy from your body or release substances that affect the way the body uses nutrients. As a result, you may lose weight without even trying. Advanced stages of prostate cancer can also show up in loss of appetite, difficulty eating, or malnutrition, all of which can make you lose weight. So watch out for these signs and get yourself checked if that's happening to you. Number 9. Fatigue or weakness. This sign of prostate cancer can happen as a side effect of cancer treatment, like radiation therapy, hormone therapy, or chemotherapy. Unusual fatigue or weakness is also related to unexplained weight loss, as we mentioned before. Prostate cancer can also reduce the number of red blood cells in your body, leading to the symptoms of anemia, which too can cause fatigue or weakness. Number 10. Loss of bladder or bowel control. These signs of prostate cancer usually show up in advanced stages, mainly because both of these signs are related to the abnormally large size of the prostate gland. When prostate cancer becomes large enough to block nerves, muscles, or blood vessels around the prostate, it can make you lose control over your urine flow. It means you may find it hard to stop or start urine when you want to. Plus, it can also cause sudden urine leakage, even when you weren't feeling the need to urinate. Similarly, your body may also lose the ability to control or hold stools, leading to involuntary leakage of stools. So it's best to get yourself checked as soon as possible if you notice these signs and symptoms of prostate cancer. Thank you for watching and subscribing to the channel. See you in the next video.